Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, President Rodrigo Duterte thanks Russia for its offer to provide coronavirus vaccine this year, saying he is willing to try to know if it's safe or not. And amid alleged corruption issues hounding PhilHealth, the president says he will go after corrupt officials in the agency. And with another single-day record high in new coronavirus cases, is Metro Manila ready to shift back to a general community quarantine status? Former COVID-19 Task Force Advisor Dr. Tony Leachon joins us live. President Rodrigo Duterte is sending a thank you letter to Russian President Vladimir Putin. He is grateful for Putin's offer of free anti-COVID-19 vaccines for Filipinos once these become available. The president says he is accepting Russia's help. Mr. Duterte says supplies and clinical studies are up for discussion. He even volunteers to be part of the trials. Here's the president in his own words.
Ako, pagdating ng bakuna, in public, para walang chat-chat dyan, in public, magpa-injection ako. Ako yung maunang ma-eksperimentuhan. Sabihin ko rin kay President Putin, malaki ang tiwala ko sa your studies in combating COVID. And I believe that the vaccine that you have produced is really good for humanity. Kaya ako, para ipakita ako sa kanila na tiwala ako at hindi sila nagkamali, nag-offer. Ako, pagdating, yung doktor nila o doktor natin, ako ang unang magpabakuna. Tignan natin kung pwede ba. Kung pwede sa akin, pwede sa lahat.
Meantime, the country once again breaks its record for a single-day spike in new COVID-19 cases. The health department reported nearly 7,000 infections Monday, bringing the total count past 136,000. 60% of the new cases come from Metro Manila. Let's go straight to the source of the story. We have former COVID-19 Task Force Special Advisor and Health Reform Advocate Dr. Tony Leachon. Dr. Leachon, welcome to the show, sir, and thank you for your time.
I'm sorry, Pinky, for wearing these shades. I woke up this morning with swollen left eye, perhaps due to an insect bite. I'm very sorry.
No worries, sir, but thank you for joining us this morning. 7,000 cases, sir, were recorded yesterday. That's the highest single-day increase. Can you explain or at least help us make sense of this number?
Well, we expected that number is almost 7,000 with 60%. That's about 4,163 in Metro Manila. We have, in the last 2 weeks, we have 4,000 cases almost on the average. And with the cases that we are seeing right now, considering that we don't have a acute, I would say, measure to counteract, but because most of our measures right now are, I would say, chronic, and it will take around some time before it will actually be effective. I don't think that the tracing, the testing, and the isolation would be available for this particular problem at this point in time. So the right approach, because those are actually in the Hammer and Dunn's theory by Thomas Peyo, these are actually done and effective when you started it early in the ball game. But with acute acceleration, the best thing for this is to prevent the viral spread is actually a lockdown or a quarantine. And we can see this pattern very effectively in Cebu. If you remember in Cebu, When there was an acute acceleration in Cebu, Secretary Simatu and the IATF imposed an ECQ, and from June 15 to July 15, now Cebu has flattened the curve and they're back to reopen the economy. So 2 weeks ago, the medical doctors requested for a timeout and basically to arrest the acute acceleration of cases and give some time also for the doctors to rest and also to regroup in terms of their plans in order to arrest the problem. And of course, the hospitals are also full, and this will also give breathing space also for the hospitals and the doctors to regroup and plan. So we have right now 7,000 cases,
So,
and I feel that
so I take it,
shift
Dr. Leachon, that 2 weeks is not enough.
2 weeks is not enough considering that we have higher cases than Cebu, and this is the national capital region, and it will take some time. And even the MECQ, I think, was a compromise. The medical associations were actually asking for an ECQ in order to acutely arrest the increase of the cases. So we're settling for an MECQ, but I think we need
Mm-mm.
another round or perhaps 2 weeks of MECQ in order to arrest the cases. The
To
problem,
be able to
the
see really the results of what
right,
government is doing, sir.
yeah,
Opo,
because in
to
the
see the results of what government is doing, you're proposing another 2 week extension. From August 18, you are hoping for another 2 week extension thereafter.
yeah, because because of the tight balance of the health and economy, the government settled for the MECQ, but there will still be mobility, and that will be a problem. Ideally, in the ideal setting, just like in Cebu, and during the first time when we have an ECQ, we had only 100 cases then, but we settled for an ECQ. Today we have 136,000 cases total, and then we have 7,000 cases yesterday, and 60% in Metro Manila. I'm not sure whether the MECQ will be effective, but since we are on MECQ, an extension of 2 weeks will be actually be effective, because we also see in the National Capital Region, the last 5 or 7 days, in Metro Manila, we see actually some downward trend, but I don't think it will be sustained if there will be mobility. In the MECQ, the guidelines will show that we will have 50% mobility. But if we will shift to GCQ, that will be about 75% mobility, and that will be a problem in terms of viral spread.
But you know what I wanted to find out, Dr. Liachon, is this. Every time we speak to members of the task force or the presidential spokesperson, and we talk about the numbers, sir. For example, now it's at 100 and I believe 36,000 plus 7,000 as of yesterday. And they always attribute this to the number of tests that we do on an average, which is about 30,000. In other words, what they're saying is talagang tataas ang numero kasi dumataas din yung ating testing. Is this kind of analysis, Dr. Liachon, is that acceptable?
Uh, with due respect to the analysis of the IATF, we consider po yung positivity rate. Ang normal positivity rate ay 5% set by the WHO, less than 5%. In the Cebu model, 33% to 40% yung positivity rate nun. So ibig sabihin may local transmission. In our case, our positivity rate is around 11 to 12%. So ibig sabihin, the difference nun, yung 5% hanggang 12%, definitely may local transmission tayo. So we have to base that. Of course, when we have tests, we will be able to unearth kung sino yung may sakit or hindi. But definitely, since we're over nung WHO normal value of less than 5%, our positivity rate right now is 12%. So ibig sabihin may local transmission talaga po. And based on the latest data coming also from the National Task Force, it's coming from the workforce clusters and of course family households clusterings. Dito po nanggagaling po yung increased cases right now po.
So, in addition to that, aside from sinasabi po sa atin that totoo naman, tumataas ang testing natin, 30,000 a day, there are other factors that need to be considered, which I really want to understand further. Number one would be, as you mentioned, number one would be the case doubling rate. Number two would be the mortality rate. Tapos yung R naught, sir. But there's also this other argument, Dr. Leachon, if you will, ano? Kaya naman talaga tumataas yung kaso natin dahil dumadami po yung testing natin, and the fact is, lumalaga na po yung pag-spread ng virus.
Tama yun po.
In other words, sir, parang hindi po na-arrest, hindi po napipigil ang infection. Go ahead, sir.
Okay, hindi natin napipigil ang infection kasi napag-aralan naman all over the world when there's mobility, talaga nagkakaroon po na increase like in Japan, like in Korea and some other places. Even in the US hanggang ngayon hindi makontrol because of the problem in mobility. Ngayon, ang problema natin, kahit mahaba ang doubling time natin, ang pinag-uusapan kasi natin, libo na eh. Hindi katulad before, kung 100 ang doubling time natin, 200 lang. Ngayon, pag nag-double tayo, let's say, ng cases, 7,000, in about, let's say, 1 week
4,000.
or about 2 weeks, o 7,000 times 2, 14,000 kagad yun. Kaya we need to arrest the cases. Ang tawag natin dyan, one time, big time, so that pag na-arrest natin siya, talaga pong maayos natin why we'll build up po yung health capacity natin.
Okay. And because pinag-uusapan nga po yung rate ng infection, that is a point, sir, that needs to be considered nga. Kasi kung dati, ang case doubling rate natin would be 7 to 8 days. That is an infection of 1,000 a day. Ngayon po, nag-average na tayo ng 4,000 a day. And in fact, yesterday, it was 7,000. Interior Secretary Eduardo Año was saying that Filipinos should actually also practice social distancing at home. The question is this possible? We'll have Dr. Tony Leachon answer that after the break. This is The Source on CNN Philippines. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, Dr. Tony Leachon. Dr. Leachon, in the event that we revert back to GCQ by August 18, do you think na masasayang ho any gains that we may have achieved during this 2-week MECQ, sir?
Pinky, sa tingin ko masasayang kasi hindi natin mapupulfill yung WHO criteria na dalawa. Ang una is when you gradually phase down, dapat control yung virus. And apparently, 7,000 yesterday, highest yun. Tapos dun pa sa densely populated area na National Capital Region. Ang pangalawa, ang problema natin, ang ating Philippine healthcare system ay hindi kayang tumanggap ng ganito as opposed to other countries na nakapag-establish na. And then our healthcare capacities to avert the arrest, katulad ng contact tracing natin, testing, at saka isolation and quarantine, hindi pa siya nakaset up ng mabuti. So dalawang problema ang nagko-compound ng issue. Medyo shaky yung ating Philippine healthcare system to start with. And then ngayon pa lang umaarangkada yung ating one command center plus yung ating mga contact tracing infrastructures. plus yung isolation and quarantine area. So sa tingin ko hindi pa tayo ready, lalo na ngayon nasa napakasobra ng taas ng ating cases ngayon na 7,000, lalo na sa Metro Manila.
What about selective lockdowns? Won't that work? Sabihin po natin bumalik tayo sa GCQ, pero magiging matindi po yung selective lockdowns.
Baka hindi rin siya maging effective kasi meron pa ring mobility. And then ang mga workforce natin, nagko-cross-border travel po sila. Let's say people, let's say in Quezon City will travel to another area. That will be a problem. Pangalawa, pag nag-GCQ po, mag-a-allow tayo ng public transport po dito. Eh, ang isang main ingredient po kaya wala pong public transport sa MECQ, sa ECQ, because you will encourage po, of course, mga tao na mas marami pong sasakay. So, din ho ang problema natin with the GCQ. The public transport will be allowed po.
Another measure that's been suggested is that we social distance at home. This was suggested by Secretary Anyo. Do you agree with this?
Well, ang una muna, i-set up muna natin. According to Dr. Danz and Herrera et al. Sa pag-aaral nila, 99% pag ang combination ng face mask, social distancing at least 1 meter, at saka face shield. I support sa Secretary Anyo kasi even at home, since I'm a frontliner and more exposed ako, pumupunta ako sa hospital. Pag-uwi ko rito, nagso-social distancing ako, nagwe-wear ng mask. And then, of course, Secretary Anyo, during our meeting nun sa National Task Force, nagkaroon siya ng COVID. Members of the family niya, nag-wear lang ng mask, walang nahawa sa kanila. And of course, in Metro Manila, na hindi lahat ma-accommodate natin in the isolation and quarantine areas, ang magaling talaga ay mag-mask din ho tayo sa bahay. Considering ang kalat daw ngayon, local transmission ngayon, ay nasa household. So, since hindi lahat po mapupunan yun, at least meron tayong pami-pamilya po ngayon eh. Ang hindi lang ho talaga anecdotal report, tunay pong nakikita ko po sa telemedicine at saka sa ospital na ang nahahawa po ay pamilya, particularly parents sila or lolo't lola from the children who are actually working at the same time outside.
So how do you suggest the public social distance at home? But let's look at an example, Dr. Leachon, na marami pong tao sa isang bahay.
Yeah. Ako, ang pagtingin ko na lang dyan, yung ating mga kababayan talaga, hindi talaga nagmamas yung iba. So at least kung meron kang mask, kahit wala kang social distancing, meron ding pag-aaral, Pinky, na yung ating hand washing plus face mask and 93% risk reduction kahit wala kang social distancing. Since hindi natin ma-afford lahat na mapupunta sila sa isolation, may protection pa rin rather than wala. Ang pinapakiusap lang natin, since may hirap sila, if we can provide sana free mask dun sa mga may hirap, because yung middle class and upper class, pwede naman silang bumili ng sa kanila. So siguro yun na isang magiging programa ng local government unit to provide free mask to the urban poor, particularly dun sa mga area na nasa mga slum area po or squatter areas po.
So personally kayo, Dr. Leachon, you're suggesting na to the public, kahit nasa bahay, ay mag-umpisa ng magsuot ng mga face mask?
Sinasuggest ko po yan kasi pinapractice ko na rin po. Kasi siyempre napipilitan po akong pumasok dahil ako po yung doktor. Eh yung mga iba nating mga kababayan pumapasok din at ang dami nating horror stories na naririnig na nahahawa ang kanilang mga magulang. So we might as well practice po yung ating a culture of commitment na talaga tayo mag-hygiene and self-care. So doble ingat tayo, lalo na kung luluwag tayo to GCQ.
And the President is quite optimistic about a vaccine by the end of the year. I wonder what you think about this. But before you answer that, Dr. Leachon, we're going to take a very short break. The Source, we'll be right back. You're watching The Source on CNN Philippines. Our guest today, Dr. Tony Leachon. The president consistently talks about the vaccine, and he is quite optimistic, sir, that a vaccine will be available by the end of the year. Do you share the president's optimism?
Well, Pinky, yung vaccines kasi, whether Russian at saka Chinese, gusto ko lang explain sa iyo, Pinky, and sa mga nanonood. For disclosure, I have 16 years of experience as a medical director of a multinational that's Pfizer. And I was able to launch one particular product, yung Prevenar, which is for pneumonia. Pag ang local FDA natin, na tawag pa dati ay BFAD, meron tayong reference countries na sinasabi nating meron track record of efficacy and safety. USA, Canada, European Regulatory Agency, and then you have the TGA, Therapeutic Goods of Australia. Ngayon, dito kung mag-umpisa tayo sa Russian and Chinese, dapat repasuhin yan ng FDA together with pharmacologists and infectious disease experts. And then sana yung kanilang clinical trials ay ma-translate into English para maaral po natin bago po ibigay po sa ating mga kababayan. Dapat maintindihan natin po yung dossier at saka yung package insert, malaman po natin yung efficacy and safety at saka yung clinical trial na ginawa po dun sa bansa nila. Pag na-aproban na po ng FDA under the leadership of Yusek Eric Domingo, pwede na ho nating itry yan, pero with supervision pa rin ng ating mga doktor. Dapat to doktor ang magsusupervise po ng vaccination.
But how long does the FDA, the Philippine FDA, have to check on the efficacy of this vaccine, if ever? Gaano katagal pa yung process na yun? Because basically what you're telling me is that if it becomes available commercially, for example in Russia, at bigyan po tayo, as the president said, you're saying hindi agad-agad yan kapag dumating sa Pilipinas ay pwede nang ibigay sa publiko.
Okay, madali lang, Pinky, yan eh. The usual kasi yung registration, let's say galing ka sa abroad. Business as usual, it takes about 6 months dati. Tapos for emergency purposes, basta according to Yusek Eric Domingo, re-reviewin lang nila yung documents of the approval in their regulatory agency, let's say Russian FDA nila or Chinese FDA. They will just review the documents, and then if they will find okay yung efficacy and safety, then a-approve nila. Ganyan yung nangyari, Pinky, for some of the products na nilabas natin na ginagamit natin ngayon for compassionate use kahit wala tayong FDA approval, yung Remdesivir, yung Avigan na binigay ng Japanese na iki-clinical trial sa atin. So kahit madaling panahon, basta't nakita nila on paper na ayos siya, mamarkahan lang natin ng FDA approved and registered, saka natin po pwedeng ibigay. Of course, with the approval of the FDA, and then to be supervised by the doctors to the patients din. Of course, mayroong consent po ito ng mga pasyente kasi considering unang gagamitin sa ating bansa.
Okay, but my question is, are you optimistic, Dr. Leachon, that there will be a vaccine available before the end of the year?
Yeah, I'm optimistic kasi dadagdag to dun sa mga bakunang lalabas from other markets eh. So meron kang Moderna, may Pfizer ka, may Astra ka pa, and a lot of... So dapat multiple yung options natin. Because alam naman natin yung supply chain na yan will not be naman accomplished. So kailangan marami tayong multi-sourcing dapat ang kailangan natin dito.
Okay, maraming salamat po sa inyo, former COVID-19 Task Force Advisor, Dr. Tony Leachon.
Thank you very much, Pinky. Thank you very much.
And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.